Okay. Okay. Excellent. All right. Thanks. I'm good on this side.
Okay. Hello, our viewers. You're welcome to the Green Talk Show. You're welcome to our third episode. This is the Green Talk Show, as it always happens on Fridays from 7:30 to 8:30, live on the My Tree Initiative Facebook page. So on today's episode, we shall be focusing on green recovery approach to the health and environmental consequences of COVID-19 and HIV/AIDS in Uganda. Today on the show, we have very amazing guests. We have very amazing guests on today's show. We will be having Miss Rowena Atuheire. She's the communications manager of My Tree Initiative. She's also the president of LIFT. LIFT is a program that she heads as the president, and she will be coming in to tell us what LIFT is. And then again on today's show, we are going to have Dr. Karusa Kiragu. I'm very aware the members of My Tree Initiative know her very well. She happens to be our ambassador, and she's also our mentor. She was in Uganda. She has been in Uganda before. She was the UNAIDS country director here in Uganda. And we were very lucky that while she was here in Uganda, she got to plant a tree. My initiative was able to plant trees with Dr. Karusa as well as Dr. Antonio. For those of you that were able to attend our show last week, we had Dr. Antonio with us last time. Dr. Karusa currently is working with UNAIDS Secretariat in Geneva, Switzerland. So for those of you that are watching, we are having her right from Switzerland, and we are very happy to be having her from there. Again, on today's show, we also have Miss Amy Cunningham. We also have her. She was here in Uganda before. She was the PEPFAR coordinator in Uganda, and currently she's serving as the USAID. She's serving with USAID headquarters in Virginia, USA. So we happen to have different people from different countries. It is really a great honor. It is a pleasure. This is going to be amazing. This is very exciting. So to whoever is watching us, please keep it locked. You can go on and share the link to this show with your friends and family so that they can come in and watch whatever is going to be happening here. For today, we will be starting with Rowena. Rowena, if you're there, you will be coming in to tell us, to explain to the youth out there that are watching us live right now, what climate action is. To someone that does not know what climate action is, you're coming in to tell us what climate action is and why is it really important for the youth, especially out there. Why should it be important for them to come in and take action as per climate is concerned? Rowena, you can come on and take on the floor. I think we're having some bit of internet connection problems, but before we can, as we wait for Miss Rowena to come up, for those of you that have been following us, I see comments are starting to come in from Facebook. We have Melissa Kiza. She's saying she's happy to be here. We are also happy to have you here as we wait for Miss Rowena to come in. But to give you a brief, for those of you that are just watching us for the first time, we've had so far 2 episodes of this show, and this is going to be the 3rd episode of the show. We will be having more episodes coming in, and we look forward to having more and more amazing guests that will be coming in. And as we wait for Rowena to come in, I'll move forward to Dr. Karusa. Dr. Karusa, we are happy to have you on the show. We are very happy. I'm really sure that the youth that work with My Tree Initiative and those that are watching us are really happy. They've known you, they've seen you attending the Maitri Initiative events. So they're really happy to have you here. So as per today's discussion topic, Dr. Karusa, if you could please kindly tell us why the youth should really focus on the environment. Why is it really important for the youth to come in and put more focus on the environment? And also, the youth that are out there might be wondering, what is the link between the environment and COVID-19? And what is the link between the environment and HIV/AIDS? Because you might find that a lot of people might be wondering, what is the relationship between these two? So please, Dr. Karusa, you could come on and explain to us the link between these two.
Yeah, thank you very much. And I want also to congratulate you, Hala, for hosting this, and my Tree Initiative, Ishmael, Anja, all these wonderful young people who are moving this forward. And I know it's a big group of young people. I just want to compliment and congratulate you for this.
Thank you.
Personally, thank you. I'm an environmentalist, and actually my own environmental, if you will, energy comes from within my family. Some of you may know of Professor Wangari Maathai. She won the Nobel Prize for Peace a number of years ago on account of the environment. She happens to come from my home village back in Kenya, as deep as you can get. And she's actually our neighbor in my grandparents' home. So we have those roots and those beliefs that we live with the environment. So when you ask the question why we should care about it, in addition to what she has done and what she has informed and what she has shared with us, for me as a public health a person, as a public health activist, is because we know we have to take care of our environment. We have to make sure that we are managing and that we are living within the environment. If we don't do that, there will be things that we can alter in the environment that can come back and can create a lot of difficulties. It's a very simple example, mosquitoes. If we don't manage the environment well, all the work on so everybody, so there's no reason to belabor that point. But maybe even just basic things like milk. If we do, there's a lot of diseases that are transmitted from the environment, from animals, if you will, to people. So to human beings. So we do have to make sure that we are aware and we are being careful about this. Coming to HIV, which is where a lot of my work now is that it is thought and it is understood that the way HIV crossed from chimpanzees to people is when people invaded the chimpanzees' territory, if you will. And we've often, as human beings, because we are predators as human beings, and we conquer, so we will sometimes enter into environments we shouldn't be. So it is understood and that is how HIV crossed over when we interacted with the chimpanzees. There's history behind this. COVID is thought to be something very similar, where whether it's bats, that story is still to be determined in terms of where it came from, but it's thought to be associated with a link between animals and people, and the virus crosses. So we as human beings have to be very careful about the environment, because the environment, and when we encroach and we over encroach into it, we can encounter pathogens that we were not aware of, and they can become part of us. That's why we have to be very careful about the environment.
Yes. Thank you, Doctor. Regarding why we should really be conversant with encroachment of the environment, you find that some people do not even know, they're not even aware of the different things that we can get from the environment. So if you could also tell the people out there of the different things that we human beings can get from the environment that surrounds us wherever we are?
So the environment is so much a part of us that we even forget that it is a part of
Yes.
us. We take it for granted. We take it for granted that when we wake up, that the sun will be rising. We take it for granted there'll be fresh air. We take it for granted that there'll be, water. Maybe it's we take it for granted that we will walk and there will be so that the things the environment gives us a lot, but because we've always had it, we don't notice it. We don't notice the challenges until we have a problem, like a flood, for example, and that is
Yeah.
when we wonder what is going on. And that when there's a fire, all these fires devastating different parts of the world, that's when we wonder what is going on, all these challenges. So we really have to also understand that we have to care for the environment. We get our
Yeah.
food from the environment. We get our
Yeah.
nutrients from the environment. We get our livelihoods from the environment. We should not take it for granted.
Exactly. Thank you, Doctor. Talking about that, um, earlier on, before we even joined in for the show, Miss Emmy was telling us about how persuasive Ismail is. For those of you that might not know who Ismail is, he is the co-founder of Maitri Initiative. Dr. Karusa, I've also been there for the times I've been able to interact with you earlier on when we were planting the trees in Kawempe. Could you tell us what really encouraged you into being there and even reaching to the extent of deciding that you should really be the ambassador of Maitri Initiative? What are your reflections as per Maitri Initiative and the work that Maitri Initiative is doing?
Sure. To me, this is my favorite story. I met Ishmael when he was working and he was doing some work with, photographs and so on. And what I admired a lot about him was his persistence and his sense of direction and sense of energy. And so we connected, we kept communicating. And I came to realize that he is a very young, he's a very determined young man, very clear goals,
Yeah.
and full of hope, full of energy, and very enterprising. But then I came to learn after that with him are other young people.
Exactly.
And so when I met him, I got to meet even more young people like him. And I find that incredibly beautiful about Uganda, that there
Yes.
is this amazing young people who are, eager, who are keen, who are committed, who are enterprising. When they have an idea, they're able to take it forward. And I just have to support those sorts of initiatives. So it's been my pride and joy. I'm so proud to be part of this. And thank you for inviting me.
You're welcome, Doctor. We are also happy to have you on the show. Um, as we proceed with today's show, Doctor, allow me invite Miss Emmy. She will also be coming in, and we'll also be having, because I see we are having comments from Facebook. We'll be having you back with questions because there are people that are sending in questions and they're saying that you should help them answer them out. So after Miss Amy, we will have you back. Miss Amy, we are happy to have you on the show. We are glad that you're watching us. You're with us live from USA. It is really a great honor. Miss Emmy, regarding today's discussion, my question to you is that the fact that you've worked with PEPFAR in Uganda and now that you're working with UNAIDS in USA, that side, you find that in Uganda right now at a time like this of COVID-19, you find that we have young people that are living with HIV. And at a time like this, they've really been through a number of situations. Um, and my question is, regarding the young people in a time like this of COVID-19, what could be your message to these young people? You find that they might have been, that they've found issues with having to access their medicine in this time. You
Mhm.
find that some of them had to impose their status just because they could get past policemen that had to impose curfew, impose the presidential guidelines in the country where people are not allowed to cross borders from one district to another. Yet you find that someone might be living in a district where they cannot get their medications. So they have to cross from one district to another. But in order to cross from this district to another, they end up having to reveal their status. They have to reveal that, yes, I'm living with HIV. I have to go and get my medication. So it has really been so tormenting. What is your message to these people? What should they do at a time like this? What could you tell them?
Thank you so much. I really appreciate that question. And I also want to second that Dr. Karusa is both a great friend of mine and also a mentor. And every time I hear her speak, I always learn something. And I love you so much, Karusa, and miss you as I'm back in the US now and you're in Geneva. But we both have the shared experience and blessing to have been able to work together in Uganda over the last several years. You've actually touched on some very challenging questions and in this time that we're in. I think none of us, while there may have been some indications that some of these things that led to the COVID-19 pandemic, as Karusa mentioned, in terms of climate, et cetera, and crossovers, maybe we had some idea. I think none of us really knew what to expect until it hit us. I was in Uganda right when it happened, and we went in lockdown just like everyone else. And there were early challenges with being able to get to clinics, say, for delivery or to get medicines. However, what I observed and what we're seeing now as USAID, which is, by the way, United States Agency for International Development, based in, is an American premier international development agency and working with HIV over 50 countries around the world, including Uganda. What we've seen is that there have been amazing innovations, often driven by youth. As we know, youth make up 70% of the population in Uganda and many other African countries. It's not only, it's actually been an amazing thing to see young people really rise up to challenges and leapfrog over things that maybe were traditional blockages. So thinking like virtual visits, telehealth, use of social media, as you guys are doing right now with YouTube. There were ways to share information about being able to get the HIV prevention services and information you need, as well as if you are HIV positive, getting antiretroviral medicines. So I know it wasn't absolutely perfect, but at the same time, I think what's been great to see both in Uganda and other countries is this leapfrogging and innovation, often very much driven by youth who are very comfortable with social media, with using technology, and we've been able to simplify services. For example, thinking about ARVs, life-saving antiretrovirals. Now, really, people are pushing, and Uganda's been out in front on this, to have 3 months of ARVs or 6 months. And I remember in Uganda, right at the beginning, working with the Ministry of Health and civil society organizations, young people organizations were mobilizing to help move, support and work with the Ministry of Health to move medicines out to people so they were able to get them. And during the COVID time, of course, you want to reduce the amount of interaction you're having and reduce the queues and things at clinics. So those kind of simplified service delivery of just multi-months of dispensing of ARVs has really made a big difference. And we've seen that that's actually helped people stay on treatment and keep them healthy and keep them productive, healthy members of society. I do think, of course, there are challenges with HIV prevention in this new environment where we have both lockdowns and maybe challenges with access to information and prevention tools. I think, again, the fact that we have so many powerful, strong, innovative, persistent, like Ishmael, young people, it's a great opportunity as well. We have all the tools in terms of how to prevent HIV and also how to live a long, healthy life if you are HIV infected. It's a matter of, I think, you all being empowered and being able to share that information, supporting each other and using all the tools that you have at your disposal, both one-on-one communication with peers. We know how important that is, as well as productive and positive use of social media. As a mom and as a public health professional, I mean, I have really been so excited to see how young people are just rising to the challenge. They want correct information. They want to be able to take care of themselves and their families. And I think really we have all the tools there. It's around how can we continue to share that information, make sure that we are also taking care of ourselves. The whole concept of self-care, where patients and non-patients as well, just members of society, are recognizing what they themselves have to do to keep themselves healthy. And combined with being able to make sure services are available and close to where folks need them, when they need them, on time, at the right time. That is really, really critical. So I think it's just been incredible to me to see all of these innovations. I think as we start seeing also, I'll just say one more thing and then stop. There are a number of new biomedical interventions that are coming down the pike for prevention, like the Atuheire ring, which will, over long-term prevention, being able to provide ARVs in your body through a ring that's inserted in the cervix. Long-term injectables, ARVs. We also have something called pre-exposure prophylaxis, which is PrEP. And PrEP is an ARV that you can take if you're in a risky situation. If you're, say, for whatever reason, you're more vulnerable. Perhaps you're having unprotected sex, which of course we encourage, use condoms. Make sure to keep yourself safe. And at the same time, if you are in a situation, and in fact, this works very well with what we call discordant couples and discordant partners, where one person is HIV infected and positive, whether taking treatment or not, and the other is not, to stay negative, to take PrEP. And PrEP is really turning things around in countries. And I think those are the kind of things that we also really need to see scale up. We need to see youth as kind of the vanguards of change in this regard, and using all the tools they have at their disposal for HIV prevention. Again, not easy, but recognizing you all have such power to effectively communicate, to do self-care, to make the right decisions and choices in consultation with your families, your communities, your advisors and peers, and stay safe. I mean, we need you. You guys are the young people who are going to change the world. And in terms of, while climate change is not my area, I see that you all are out in front. And I'm so happy that you're taking this all seriously. It's something as well the U.S. government is clearly very, very concerned and positive about, wanting to engage with young people and other climate activists to get in the game and make sure that we're part of the solution.
Thank you so much, Miss Amy. I've been going through comments that are coming in from our viewers from Facebook, and we have some good questions that are coming in. We have Miss Amy, I think this is coming directly to you. We have Swabul Siraje. He's asking that what advice do you give to youths with HIV so that they feel useful because they are, and how could they cope up with their status? I think you've told us what we should do. We should keep safe. We should use these services that are coming in. And shortly about the services that you are talking about, are these rings, the contraceptive rings that you are talking about, that can help you and can save you from getting HIV, are they really accessible? Is someone able to get them? Like in a country like Uganda, can we access them?
Hi, okay, I see some of the chat questions in. First and foremost, I would really encourage anyone with a medical question to seek out. I mean, Dr. Karusa could perhaps speak to some of this. I'm not a medical doctor, so I don't want to give any kind of medical advice. I strongly encourage you. You've got fabulous clinicians in Uganda, both in the public and private sector. Please, and there are many youth-friendly clinics as well. Please don't be shy. If you need to, write your questions down in advance. When you go to speak to someone, you can also do it online. And there are many, many resources where you can share your questions and get medical advice from trained professionals. I am not a medical doctor, so I do not want to give any specific advice. So I highly encourage you to talk to professionals in your community. I have complete confidence that having worked with people in Uganda and clinicians for over 20 years, some of the best in the world. Many of the famous research studies that have led us to have antiretroviral drugs, to have medical male circumcision, et cetera, came from Uganda. I would say, so I'll sort of defer and punt on that one a little bit, but on the question around youth with HIV, thank you for raising that. I think number one, really, it's really about having respect for yourself, taking care of yourself, and not feeling self-stigma. We need you to speak out about your experiences, how you take care of yourself and your health, how you can help other youth stay HIV negative, stay healthy. And more than that, that having HIV is not a death sentence. It's a lot. Now you're taking one pill a day. And there are new products coming, as I mentioned, at sometime down the road. We're looking at hopefully injectable ARVs you'll take only once every couple of months. And so the world is changing in terms of the medicine. That'll be fabulous. Or the ring, which is also providing protection for prevention. These things are all coming in the next couple of years. So stand by as the research is done. But at the same time, so that'll make your lives easier, but please don't feel like just because you have HIV, whether it was contracted through birth or later on, that doesn't make you any less of a person. You have so much to contribute to the world. It's a challenging thing you're dealing with, but you're also dealing with it. And it's about resilience. Young people, you guys are very, very resilient. I would also just put a plug in, as many of us are starting to really look at the broader kind of mental health concerns. My feeling is we've always been doing mental health and HIV. We've always, from the very beginning, helped people deal with their status, their how do they manage disclosure? How do they manage taking medicine every day? How do they manage day-to-day life? And in a time in the early days where there's so much stigma about HIV, stigma was really, quite debilitating for people. I think things have changed a lot now, in that also talking about your experience, your status, finding a resource within either the health sector or a friend or a family member or a peer. There's so many great peer groups. Karusa and I were, Karusa, you are very involved with Y+. I love those guys because they are not shy. They're just going to come out, show their stuff, do their fashion shows, show that they are really valuable members of society and actually making a big difference. Just an HIV status, positive status, doesn't mean your life is over. It means you have to take self-care. You have to rely on the medical professional advice. You need to take your medicine as directed every day. And you can do anything you want to do. Go back to school, start a business, be an innovator, have a family. So I would just encourage you, think positively, reach out and find other young people like you where you can share experiences. I love Y+. I think that's a great resource. And I'm sure that we can get that information to you here in Uganda. Over.
Oh, thank you so much, Miss Amy. Talking about the Y+, I personally have seen these guys coming out to an extent that they even have where young people come up and talents, they get to pick the Miss and the Mr. Y+. So it is really amazing. And to the young people that are out there, and I'm very sure that we have different people from different regions that are watching us, please take note of whatever we are having tonight, because it will surely come in and help us. Dr. Karusu, we are having questions that are coming in. We have Swabur Siraja. He's saying that, Doctor, what could be the health impact the environment has to the HIV people? I think this is a great question. The fact that Doctor said she happens to be an environmentalist, and she has also worked with people that are living with HIV.
Yeah, that's so then one of the things about people living with HIV and the environment, and I want to echo what Amy has said, and she's spot on everything she has said is really critical, and I so much appreciate that. In terms of HIV and the environment, one of the things that for me, I think is important is about nutrition, because it's important to have good food. It's important for all of us to have good food and to have good air, and so and in particular for people living with HIV. I know in the first lockdown last year, one of the main things that people had to deal with, people living with HIV, was lack of food, particularly in urban areas. Maybe not so much in rural areas, because in rural areas you have your, gardens and shambas and things. But in urban areas, actually, food became an issue. And that was, to me, a direct link to the environment. So I would say one of the key things is the environment. In fact, in the days before many of you were born, one of the things that we were doing with people living with HIV was to support issues around productive agriculture, so that it did not take so much energy to produce. They had this hanging baskets or hanging gardens where they were teaching people living with HIV how to farm in a way that was not so energy depleting. That was before there was medicines. Now, of course, there's medicines, and as Amy was saying, one can even get a 3-month supply, and maybe even a 6-month supply. But the issue of nutrition, I think, is quite is a very critical link. Obviously, clean water is another critical link, and bottom line is shelter as well, because ultimately, one has to have a place that they can consider home. But if one is moving from one place to the other, it becomes very difficult to even get medicine. I know people who have to go and get their medicine from very far away because they don't want to be stigmatized. So you can imagine if you're all of a sudden shifted into another place because of lack of shelter. And some of this may have to do with the environment. Yeah, there's definitely a link. Over.
Thank you. Again, going through comments that are coming in from Facebook, we have someone saying to Miss Amy, thank you for the great advice. I'm allergic to some drugs. What do I do? And the vaccination has to do with the other. As earlier on, Miss Amy told us, you should not feel shy. You should freely go on and visit the medical personnel that are around your area. You could go on so that you can get better medical advice from the people that are around your community. We have Ismail, he's saying to Dr. Karusa, what's your idea about trees being a way of honoring heroes for COVID-19, for those who have passed, to celebrate a birthday, graduation, and others? From Ismail.
Sure. I think there was a first question for Amy. I should also just clarify, so I'm not going to answer that question, but I should also clarify, like Amy, I'm not a medical doctor, so I'm very careful not to give any clinical advice. I'm a public health specialist, so I look at things from that perspective. But coming to Ishmael's question, I've always been, personally, I've always been a believer in trees, the environment, trees in particular. And mine came about because when I came to realize that whenever we attended funerals, so many people were dying of HIV in the old days, not so much now. And then they'd be buried in a coffin. And I always used to think about, and then, people would plant flowers, or I say, why don't we plant trees? Why don't we honor people? Why don't we recognize their lives by planting a tree? A tree lasts forever. And as they say, the best time to plant a tree is 20 years ago. The next best time is now. So I've always felt that trees are a really incredible way of honoring people, our loved ones, for any reason. Now, when I met Ishmael and Anja and others, they moved it even beyond. And now there's honoring heroes, recognizing all sorts of events. To me, I think the whole thing about my tree, my own tree that I have planted, the tree that is mine, has a very different meaning than driving by and seeing trees that exist planted by others. But if I have mine, or if I have 10 of mine, if I have 20 of mine, or if I aim to get 30 of mine, to me, I feel that that's a huge contribution. So that's why my tree initiative is so meaningful, because it takes it beyond, it takes it to ownership.
Yeah, thank you so much. Like you've said, my tree has really done a very great job. Like earlier on, the fact that in Uganda we lost so many medical personnel to COVID-19, my tree initiative was again able to plant trees honoring heroes, not just the medical workers, but also to the journalists, because you find that it is these journalists that were bringing in information time to time to the people. The fact that we were in lockdown, we could not move around, so the journalists were doing a very great job to bring in information to whoever was in the lockdown. I see we have Rowena is back. Rowena, we are happy to have you again. I think we can go
Thank
on so
you.
that you can go on and explain to us why the youth out there, why the youth that are watching us live now should go on and take on climate action. The fact that this is the Green Talk Show, we should talk green. Rowena, you can come on and take one.
Thank you. Thank you so much. Can you hear me?
Yes, Rowena, we can.
Okay. Okay. Firstly, I'd like to thank Dr. Karusa, our mentor, for being with us today,
Yes.
and Miss Amy. We're very happy to see, and I'm very privileged to talk alongside two great ladies that inspire us. Um, I found Dr. Karusa talking about the trees when probably when we plant them, like maybe on the graduation, a birthday, it brings meaningfulness to us. You know, when you plant it, probably when you are 3 years old and you grow with it, it really brings meaning to your life. So I would like to talk about climate change and HIV. I'm going to link the two of them. There is what we call the climate refugees. I'm going to give an example of Bududa and the floods in Kasese recently. It's because of the climate change that there are the landslides, that the floods are there, and then people are displaced to go. And among those people that are displaced, there are people that are living with HIV. So some of them
Yes.
will, of course, when you see landslides coming, you not remember that, oh my God, let me go and get, my ARVs, and I go with them. You're thinking about saving your life and saving your family's life. So you find people just, rushing away to go and get shelter so they can save their lives. And then it takes time. Usually we can clearly see on TV, usually people are rushing to help them with food, with shelter. And you know how people with HIV usually tend not to talk about it. They don't want to come out in the open about it because maybe they're fearing discrimination. They fear about, how people are going to look at them. So they keep quiet, and then but they're suffering, they're scared that maybe because I've taken probably a week without taking my ARVs, what could happen to me in a week or a few days. So it's one of the things that we have to look into in the refugees, because also I deal with refugees. There are these people who come from South Sudan. Someone will be telling you, oh my God, I've spent over a month without taking them. I'm fearing for my life. What is going to happen? So a lot of sensitization has to be done in that area. And also every time there is a situation, climate, the floods, the landslides, anything, I think they have to rush to also to help the people with HIV. Another thing I would like to talk about, the youth and climate. I was showing you now how the interchanged, how climate, now for us to avoid the floods, to avoid the landslides, we have to plant the trees. We really have to plant trees. And youth inclusion in solving such issues. I'm very happy. For example, my tree initiative, Ismail and Ashraf, have done a great job. Imagine these are youth, they are very young people, and they're taking action, you know, because many times we've seen international conferences, you know, about climate and everything, but as long as we involve the youth and they are passionate about something, they'll make sure they implement whatever is being talked about. So it's a very important thing, and they really go hand in hand. I have seen it with my own eyes. And then another thing, you know, in rural areas, there are what they call agricultural groups, like different women, when they're going to start a season for planting or harvesting, they come together, you know, to plan for the season. They're usually very organized groups, and they can also be used to sensitize people about HIV. It's a very good thing that they could look into. Yes, because they're very organized, and you know, these people, they have people living with HIV and everything. Then another issue I wanted to talk about, you know, when we were in school, I don't know how, like, if you passed through this. I'm very sure many people passed through it. When we were in school, they used to say, people used to come and, you know, play skits about HIV, how we should protect ourselves. They bring us flyers, posters, and you know, with COVID and the closure of schools, it is a bit down, and yet people tend to know more about it in school. So I think we need to go back to the skits, since now most people are on social media, people are on TV. We can now do more the skits, and we can do for both climate and also the HIV sensitization. Talk about the skits for the climate change, and also skits and that even bring artists together to sing about it, because some people are inspired by some artists. So probably when they look at them talking about it, and I'm happy that Ismail also has been involving us. Ismail and Ashraf have also been involving artists in that tree planting. So when someone says, "Oh, my role model is there planting a tree," they'll be very inspired to also go and plant a tree. So, yeah. So we are really doing a great job as the youth. We really have to involve the youth in decision making, because as long as they're passionate, they'll definitely make sure that everything is implemented. I think that's most about it.
Thank you so much, Rowena. You've talked about skits, and actually you've reminded me how my tree initiative has been able. My tree initiative, I personally was part of the times when my tree initiative had to go to schools. We actually went to primary and nursery schools, including secondary schools. We could go and plant trees in these schools, and you find that the young kids, this is a new experience to them. So it is very exciting to them. So you get to sensitize them, tell them how they should take care of this tree, how they should come up every morning when they report to school and check on their tree. Some could even actually give these trees name. They could say, "No, this is my tree and I'll surely take care of it." So I think we can do an even greater job with the skits, especially when it comes to the primary and secondary schools, because you find that in the setting of these schools, they have time where the kids get to showcase their skits regarding different topics, and this could really help us a lot. Rowena, we have questions that are being directed to you. Someone is saying to Rowena, what lessons do we learn from the legacy of Ambassador Nakajigo of conserving the environment? He's asking the lessons that we get from legacy of Ambassador Esther Nakajigo.
Yes. Ambassador Esther Nakajigo, the late, she was Uganda's first ambassador for women and girls in Uganda.
May her soul rest in peace.
Amen. She passed away in the US, and you know, because of a storm. And we all know that storms is because of poor climatic conditions. Over the years, we've seen countries gathering together about, you know, there is increased global warming and everything. So actually started, giving more attention to climate after she passed away. I mean, if we could be planting trees, using better greenhouse methods, we would probably not have such storms that, just because she was in a car, and then because of this storm, imagine a getting from the ground and just hitting her by the car. So, it was such a strong storm. And probably if we're using better greenhouse methods and planting trees, it would not happen, would not we'll lose such people, because she was an advocate for the girl child. She was helping very many teenage mothers. She was helping many refugees and so many other things that she was doing. But then we get to lose such people because of poor climate conditions. So it is definitely a call for us that I lost a friend. I even lost another one due to heavy storms here in Kampala. So and we've been seeing floods. Imagine our capital city, sometimes they are flooding. So we definitely have a very big job to do. And I call upon everyone, let it happen to me and Essie's family. It should not happen to you. So and it takes just one person who can't wait for everyone. It just starts with one. I mean, if I do it, how plants a tree. Someone else, Ismail, Ashraf, Dr. Karusa, Miss Emmy, it takes 1 + 1 + 1 + 1, and then we shall live in a better place. Maybe one more thing. There is, in Mukono, there is a teacher. He's a head teacher of one of the Seta High schools. He uses bottles, the plastic bottles, and he made a hotel, even the beds and the fence, everything. Yes, and it's very beautiful. It's very artistic, and it has very good quality. And these are plastic bottles that would probably be in the ground, destroying our environment. So we also need to come up with such creative ideas as the youth, because we're really creative, so that we can make our world a better place to live in.
Thank you, Rowena. We're really having a lot of comments that are coming in from people that are watching us. There are really so many. We have Mitna Uthman. She's saying, thank you, Miss Rowena. We have Willix Williams. He's saying, Rowena, that's wonderful. We also have Asiku Roy Bright. He's saying a YouTube channel should be a great way to sensitize the masses on climate and people living with HIV. My Tree Initiative has a YouTube page. It is at My Tree Uganda. For those of you that might not have it, you can go on and subscribe. And the other thing is that we get to host these shows from the first episode. Even today's episode will be uploaded that side. So you can go on and watch these shows right from the first episode that we had. Thank you so much, Ms. Rowena. We have another question. It is being directed to Miss Amy. He's saying that how would we, the youth, deal with and fight against AIDS and COVID-19 related stigma and discrimination? I think this is what we started with, the stigma and the discrimination.
Oh, hi. Yes. Thank you for that question. I think you all can look inside and also find the answers yourselves. I actually just did a quick check online. While I'm not in Uganda now, I follow very closely the work that the U.S. ambassador in Uganda does, and looking at one of her recent speeches. This is Ambassador Natalie Brown, and she talked about investing in youth in East Africa at a recent speech she had with the Rotary event. And I just found it so fascinating because she talked about how 80% in Tanzania and Uganda of youth, and I think I probably could throw in Kenya around there, are of people in our countries that you're living in are under the age of 30. And so when you talk about the work that all of us are doing, myself, others working with the U.S. government writ large, whether investing in HIV, including anti-stigma work, anti-discrimination, human rights work, whether it's in power systems, whether it's in education, or whether it's in climate change, you're actually really talking about investing in youth. If you just think about it, the math, 80% of the population under the age of 30. So the work that we're doing and that you're doing, it's investing in youth. So I think you have a lot of power and opportunity as young people to be able to affect and make change. You don't need to sit back and wait for someone to do something for you. I think you all have the beauty of a generation that has access by and large to technology that none of us had when we were young. And with that comes education and awareness, like what you're talking about right now. While I'm not a climate change expert at all by any means, I'm certainly learning as a human being and looking at, in our own country in the US and the recent UN report that came out that really says we have to act now. There's no doubt about it that we have, and you all as young people have the information to take action as members of your society, wherever you're living. And I think that by talking, simple thing about stigma is by talking about it. And that goes for anything, even stigma around things like climate change, where there's been a lot of sort of in the past sort of negative comments about it. But because now we're having this information, this new UN report, and people are taking action, and in many countries, Uganda as well, certainly United States and others, are taking action to address what we see happening and the evidence that's come out of this recent report. And young people, it's, you're inheriting this world and you'll be building this world for the future generations. So I think there's so much power in youth. We have so much confidence in you. We are here to support and help you. And our only goal really is to support the youth of Uganda, Tanzania, the youth of the globe, to be able to help be part of making a better a world for all of us. So do not in any way think that you do not have power. You have power. You saw Greta Thunberg last year, right? You have power, you have information. And I think it's really up to all of us, the young people, the older people, our leaders, our businesses, our farms, our families, to really collectively work together to address these challenges.
Thank you so much, Miss Amy. You've talked about the youth being the backbone of everything that is happening. Yes, we talked about the youth coming up with organizations, NGOs that have really done a tremendous work. They've done a lot in developing the communities where they're living. And if the communities are developing, then the whole nation is going to be growing. What is your opinion on the main sectors where the youth could get hold of tangible opportunities?
Actually, I want to jump in on something. I think it's around young people and innovation. Listen, during COVID, not just things like multi-months of drugs. One of the people in the chat was talking about some of the challenges in Rowena, but system changes that make things simpler for people. There's an example I just learned about some innovative young people in Gulu. And it was a young Ugandan, and also a colleague who was an American alumni of the Fulbright Exchange program. They developed a prototype of a face shield made from recycled plastic. This is during COVID, through a social enterprise called Taka Taka Plastics. I just read about this. And their product, these are just young people thinking, how do we take advantage of these bottles that we could use as PPE, personal preventive measures? And apparently these products became very, very desired in Gulu and early on by doctors who needed help in procuring personal protective equipment. So things like that. We're seeing again and again that young people, when you think about it, sometimes it takes a younger eye, maybe. I like to think I have innovative ideas here and there, but honestly speaking, young people are wired. They're hardwired to be innovative. So if you look at a problem and you think, I might have a solution for that. Don't just push it aside thinking, I'm too young, nobody will pay attention to me. Take it up. I mean, there are ways you can access as well through online programs, through connectives like the Young African Leaders Initiative, through NGOs where you all can get together and take some innovation. Who would have thought taking recycled plastic bottles and making PPE? Obviously, some old person did not think about that. So I think be innovative, act on your innovations, be assertive, as Ishmael was saying, Amy, we really want you to come on the show. I think you have a lot of power and strength and ability to do that. Use social media in productive ways and move forward with ideas that you have. If it's a good idea, it'll find a market. And certainly we need as many good ideas right now as we can get.
Thank you so much, Miss Amy. I think for today's show, we're really getting people that we should really be looking up to. Ismail, he's doing a very good job. He's doing things that people might think might be hard, but in the other sense that they can be done. It just takes confidence. It just takes you giving in all the time you can get, coming up to people, explaining yourself and what you think should be the way forward to whatever situation might come in our community or wherever we might be living. And then I think to the young people, from what Miss Amy has said, I think we should really look up to being innovative. There are lots of things that we can really do. This should not just come up. It might take you some time. It might take you some good days of having to sit down, think of something, do some good reading. Some people might find it hard to sit down, open a book and start reading. We really need to be educated. We really need to be informed on whatever is happening in the country, whatever is happening outside our countries, so that we can move forward. Dr. Karusa, what would be your last message to the youth regarding the climate, regarding HIV/AIDS, regarding COVID-19? What is your last message as we come to the end of today's show?
Thank you very much for this opportunity, and I really echo what you've just said regarding what young people can do and what young people are already doing. I'll just make two key points. Uganda already has a very large number of committed environmentalists. Greta Thunberg in Sweden, but if you remember the picture of Greta Thunberg, on that picture was also a Ugandan, Vanessa. I can't remember her last name. She's there. She's out there. She's a resource. So Uganda already has, our own Vanessa. So I just the other thing I wanted to mention is in terms of young people. And the point that Ellen is making is so important for young people to feel confident. And even if things are not working out, to still get up and keep going. I read somewhere that 80% of our thoughts are usually negative. They're usually, oh, I don't like what I look like, or I don't think I'm going to do well, or I don't. Once you understand that 80% of your thoughts are negative, believe me, you'll find a way of flipping that over time because you become more conscious. So I would say for young people, and especially this young age, do not be negative about yourself. And if you find yourself being negative, be aware that other people are negative. It's not just you, but it's you to make yourself positive. So remember, 80% of people think of them negatively. Don't be one of those. And the other thing I wanted to echo, if I might, in terms of the environment, and is that I applaud the work that my tree is doing with the heroes. I wanted to plug in, and I know you've thought about this, but I wanted to just make an added plug. Some of our most important heroes are teachers. Everybody knows that one teacher. I also think some of our really critical heroes, even though they don't always come out sometimes that way, is the law enforcement, the policemen. Believe me, when you have a problem, this is where you go. And and even though, yes, we do see all those, but still, so I would just say maybe put your next level of heroes in addition to the healthcare workers and journalists. Put teachers in there, and then also put law enforcement. But I just want to thank you for this opportunity. It's been fantastic, and I'm just so happy that I'm so privileged, and thank you so much. And you connected me to my friend Amy, so it's even better. Thank you.
Wow. Thank you so much, Dr. Karusa. It has been a great pleasure. It's so sad that the show has to come to an end, but we could still do this for more 30 minutes. Miss Amy, we could have your last message for tonight.
Oh, wow. I just want to echo what everyone else said. I love what you said, Karusa. Get up and keep going. Some of the things that young people are coming up with, using technology to move like produce to market, using it's just amazing. So I encourage you to keep getting up. As a mom, I mean, that's the greatest pleasure we have is our kids being able to take care of themselves. And I know your parents want that, and the folks in your family as well. I love that idea of bringing in teachers and law enforcement who need to be partners with youth. And I'm so excited that you brought me in, and I'm going to go out and plant a tree as well. I think maybe today. I'm in Wyoming right now, where there's a lot of it's very, very dry, big climate issues here. Thank you so much, Ismail. Thank you so much, the rest of the team. I really appreciate it, and love to meet you both, and all of you, rather.
Thank you so much, Miss Amy. It has been a great pleasure. We look forward to having you even some other time. Rowena, you could come in and give us your last message to the youth out there that are watching us.
Thank you very much. Thank you, Ismail and Asha, for what you're doing. Thank you, Dr. Karusa, Miss Amy. And whoever is watching, please go plant a tree. Tell someone else to plant a tree. And I'm requesting all of you, please do something positive for a friend. And let's listen to what Miss Amy said. Let's protect ourselves. Okay, yes, youth, let's protect ourselves. And so that we can, help UNAIDS to achieve what they want to achieve by 2030. No more AIDS until from 2030. Yeah. Thank you so much.
Thank you so much. For those that joined us in late, we had Dr. Karusa, we had Miss Amy from USA, we had Dr. Karusa from Switzerland, Rowena from Uganda. Thank you all for watching. Tune in still.
Bye.
Thank you all. Thank you all.
Thank you. Thank you.
Fantastic
Thank
show.
you so much.
Thank you. Bye-bye.
Bye.
Bye.